Going home after a major surgery is indeed a daunting task. Add to that the responsibility of a new baby, and it sometimes turns to be an unending task for a new mother. Hi friends, I'm Dr. Mitali Vasavda, obstetrician and gynecologist, and this is my channel MyGynac, which gives you your health in your hands. So let's see what happens after you've had your cesarean section and you're going back home. Definitely, like all mothers, your first concern will be the scar of the cesarean section. A lot of times, initial period, the scar will be covered by a dressing. But you will be aware that underneath the dressing, the scar might appear slightly raised and pinkish. Be assured that this might remain so for up to 3 to 4 weeks, after which the scar will slowly become of the same level as your skin. The color will also change from pinkish to more of your skin color, or maybe slightly whitish or silvery in color as time passes. It can get a little bit itchy at times when the healing process is going on. Make sure if the itching gets too much that you show your gynecologist to rule out any infections. The red signs to watch out for is if there's any throbbing pain, if there's any discharge coming out from the scar, then that needs to be seen by a doctor. Once your doctor removes the dressing and allows you to take a bath regularly, make sure you keep your wound clean by washing it with a mild soap and water. Sometimes it's also enough to just allow water to flow over the scar so that any dirt or grime are washed off. You do not need to rub the scar area very thoroughly, nor you need to be scared of touching the scar. Like you wash the rest of your body, you can use the same force and same pressure to make sure that your scar remains clean. After you've had a bath, make sure to dry the area where the scar is. It would be sometimes alright to dab it dry with a clean towel or a tissue paper to make sure that all the remnants of the moisture are removed so that the scar area remains completely dry. The other major concern immediately post-partum, once you're home, is the pain. Yes, it is indeed incapacitating, but we also have to remember that although a cesarean section is a very common surgery, even then it is a major surgery. Hence, the scar and the cut which is there, it's going to have some amount of pain for up to a week's time. A common mnemonic I give my patients is to make sure that every day the pain is getting better than the previous day. If that is the case with you, you are on the right track. But if you feel that somewhere down the line the pain is getting worse, unbearable, throbbing, or if you start seeing some discharge or redness around the scar, that is the time to seek your doctor's attention. Most of the times, you would be advised painkillers for at least the first 1 week that you go back home. Don't make the mistake of skipping those painkillers in the initial 1 week at least, because it will let the pain build up and it will incapacitate you and it will prevent you from getting back to your normal routine. It is extremely important that you go back to your normal routine as far as possible to prevent all the complications because of immobility, most important one of it being a deep vein thrombosis or clotting of the veins in your legs. Make sure you go back to your routine, mobilize, walk around in the house, take 15 minutes, 20 minutes walks as you deem suitable and as in a way that doesn't tire you out completely. So in a nutshell about your scar and the pain will slowly subside as the scar starts to heal. Make sure you take painkillers throughout the time that you feel the pain. Don't avoid your painkillers. The other important do not do instruction would be don't soak your scar in a water tub or in a spa or in a tub where there are jets of water coming onto the scar. Also avoid going swimming in the initial part till your healthcare provider or your doctor clears you for these activities. The next concern for most women would be the bleeding after a C-section. How long can the bleeding last? How heavy should it be or should it not be? Bleeding after a cesarean section can last up to 3 to 4 weeks after having had the surgery. However, same way as in case of the pain, you have to make sure that the bleeding is slowly coming down. It should not, if it suddenly increases or becomes painful, make sure you talk to your healthcare provider about it. Most of the times after having had a C-section, bleeding will last for up to 10 days after the procedure, and slowly the blood will change into a brownish discharge that will fade off and turn into a pinkish discharge, yellowish discharge, followed by a white or a clear discharge. The discharges that you get after having had a C-section or a normal birth are normally called as lochia. The color changes of the lochia also give us a lot of inputs about how the lining of the womb is healing and how you're doing overall in terms of recovery after your surgery. Your next concern, and most importantly so, would be when will you be able to get back to your original daily routine? Would you be able to drive? When will you be able to travel? The answer to this is yes, you can get back to your original routine as soon as you feel well enough to do that. My tip here would be listen to your body. Most of the times through life, we are expected to flog our bodies or push our bodies to the limit. Well, this is definitely not the time that you do that. So if you're tired, take that break. There's no harm in doing that. However, you can go about your routine activities or light housework within 10 to 15 days after the surgery or the delivery. In this case, after your cesarean section. But especially after a cesarean section, make sure you do not lift anything very heavy. As a marker, you can use anything heavier than your baby is not something that you want to carry in the first month after having had your surgery. Driving would be possible, but give yourself at least 20 days or 3 weeks before you resume driving. Sometimes there could be fluctuations in the blood pressure, in the sugar levels, and if you black out while you're driving, that can lead to a disastrous problem. Expect to get tired easily and do not push your body to a point of exhaustion. Take a lot of breaks, break down your task into smaller intervals, but you can absolutely complete those tasks. Another question most women have post cesarean section is when they can get back to the gym or their fitness routine. So ladies, I would urge you to wait for around 6 weeks or 1.5 months post your cesarean section to start with strength training or with a vigorous cardiovascular routine. Mild exercising, walks are completely alright, but before you go into full-fledged activity as you would be perhaps doing before, give your body about 6 weeks to recover and get back to the pre-pregnancy state. How soon can you resume sexual intercourse? Well, again, 6 weeks is the golden time. 6 to 8 weeks is when you can resume intercourse. However, make sure that you are mentally and emotionally ready apart from physical ability to start intercourse. Other forms of lovemaking between a couple are absolutely fine and can be done gently, but for intercourse, definitely wait for 6 to 8 weeks. Another question that we normally want to understand is, what about the mood changes? Mental health is of utmost important for any kind of recovery, and same is the case after a cesarean section. After a delivery, a C-section or a normal birth, it is very normal to feel sometimes disappointment, sadness, a little bit of a depression, easily you start crying, you are sometimes anxious, agitated, irritated. It's important to know that it is absolutely normal to go through these mood changes and mood swings. You are opening an all new chapter in your life, and these changes can bring on these kind of emotional outbursts. However, if it lasts longer than 2 to 3 weeks after your childbirth, make sure you talk to your healthcare provider or your gynecologist about it, and make sure that they give you a proper solution for the same problem. It is all right to have postnatal blues for a while, but make sure you have a support system that can help you tide over that. I hope you liked this video and it was helpful for you, all those women who are recovering from a C-section. I hope you found something that solves all the problems that you perhaps had in your mind. If you have any more questions, we are happy to hear from you. There is an email address given. Write into us and we'll try to bring those issues to the forefront so more women can be benefited. If you like the content of this video, please don't forget to like, share and subscribe. Signing off for now. Thank you.